I could not wait for this program. We were talking about it for months and months before it actually came.
I said I was ready to give up on, because I couldn't pay for medications or fix my heart, which I knew was wrong with me. And she said, hang in there a little bit longer, and she said, I think we got a program that's gonna come by and help you. Just keep it up, keep up with this, keep taking care of yourself, and don't give up. And within a month or two later, it kicked in, and I was able to get better and healthier.
It's very important to me too, because I've been holding a surgery for more than a year. And after I receive that, then I have to do my surgery.
So MetroHealth Care Plus, in a nutshell, allows for people who have never had medical coverage to any significant degree, people who are distrustful of the medical establishment, and which generally fall into the same category of folks, to regain trust and start to become more involved in their own care, both preventative and active medical problems, so that the whole healthcare profession becomes more efficient, in that these patients are having their needs met in the way that they were supposed to be met, as opposed to just urgent needs such as the emergency room.
If I didn't have Care Plus, I'd be in a lot of pain still, I think, waiting for me to get a job, which would be a little hard to do because I wouldn't be able to walk at the time. So now that I can walk, I don't have to restrict myself as to what kind of work I can do.
I saw a woman in the hospital a few months ago who was 47, she was diabetic, she had worked all her life, and she worked cleaning houses and did not make enough money to be able to pay for medical insurance, and so she didn't have access to medical care. She was diabetic for many years, and she was taking her mother's medication because she didn't have access to anything else. And her diabetes was not well controlled. And ultimately she developed a foot infection. Actually, she developed infections in both feet. And she ended up having both of her legs amputated. And she's not going to be able to go to work cleaning houses. For her, this was the end of the road. She had to wait until something really horrible happened, before she was actually able to get the medical care that she needed. And, I think that that's really tragic, and it's avoidable. And in this society, I think that we should really take care to help people work as long as they can, and as long as they're able to.
Patients who will be enrolled in Care Plus will get comprehensive care throughout our system. We are an integrated delivery system, and that care will start in patient-centered medical homes, where patients will be encouraged to develop a relationship with their primary care provider, either a physician or an advanced practice nurse. They'll have access to a team of professionals, and they will also have access to a nurse care coordinator who will help them manage their chronic illnesses and help them navigate the healthcare system to benefit them best, as well as benefit the system best.
About the only way I'm able to see my regular doctor, and also just to get health care in general, because I actually had an incident where my meniscus in my knee went out, and I had to have surgery. So that happened 2 weeks ago, and it's all better now, and I can walk perfectly well and it doesn't hurt.
Medical problems tend to get worse, and if you don't deal with them early on, they tend to get a lot worse eventually, and they lead to complications, and it costs a lot more to take care of the complications than it does to do the preventative stuff up front. And so if you can manage a chronic illness over the course of many years and avoid the complications, then people are able to stay productive, they're able to work, their quality of life is better. And so it actually costs less to take care of patients if you're doing the regular maintenance things than if you're just dealing with the complications. And previously, You know, we're mostly dealing with a lot of really horrible complications, things that are avoidable in people who have access to health care.
I can't tell you what a relief it is to be able to help somebody get the care they need, whether it's medication, specialty care, referrals, durable medical equipment. I can't tell you what a relief it is for them to be able to offer these services to people and to not hear, "I'm sorry, I can't afford it." Those are some of the most crushing words I as a physician hear, because I think I know what can help people, but if they can't afford it, they're simply not going to get it. So Care Plus allows people to get what they need. They, in turn, then become healthy, they work, they contribute to the communities, they're more involved in their families. It's a wonderful program.
Well, if I didn't have MetroHealth Care Plus, I'd probably be dead right now. I'd be 6 feet under, wouldn't have a medical device, my heart would have stopped. And I'd be in the grave. I wouldn't be talking to you right now. Yeah, I hope they could keep on going for, well, not only my sake, not to be selfish, but, you know, for others too. And just to help people to get, keep them going, give them a fighting chance to live.